Hello, good day, students. So I am Camille, and I will be the one discussing the spinal cord and reflexes. So in this slide, I'm just going to show what references I've used in creating this lecture. It's mainly from Snell's Clinical Neuroanatomy, but you can also read Waxman and Seeley's Anatomy and Physiology. Here are the other suggested textbooks that you may read if you want further clarification on certain topics all throughout this recorded lecture. Alright, so let's start with the spinal cord. The spinal cord is such an interesting structure because this is the bridge between the brain and the peripheral system. Now, without it, our brain cannot communicate with our hand or our feet, all of the distal parts of our body, and vice versa. So, it's the major communication link between the brain and the peripheral nervous system, and it integrates incoming information through your sensory pathways, which we'll discuss later on. So, it will receive information. Pag na-receive niya na yon, dadala niya, it will transport those information to the brain. And then, same goes when it comes to the brain naman, the one sending signal. So, the brain will send signal to the spinal cord, and the spinal cord will integrate all of those information and send it to the effector organs via your peripheral nervous system. Okay, so aside from that, your spinal cord also produce a response via a reflex mechanism. We have certain pathways that does not require passing through the brain anymore. Ito yung mga simple reflexes natin. Kumbaga, meron na siyang innervation on a muscle, for example, on a muscle, and then automatic yun, magkakaroon siya ng connection via interneurons within the spinal cord. Hindi niya na kailangan humingi ng go signal from the brain or the higher cortical areas para mag-respond. And that is an example of a simple reflex mechanism. Now, that's why when we touch a hot object, the first thing that we do is we remove our hand, no? And that's the best example of a reflex, and that is through the spinal cord. Again, imbes na pumunta yung signal na yun, yung na-receive na sensation natin na mainit, increase in temperature, doon sa brain, magtatanong muna tayo, no, anong kailangan gawin. Your spinal cord is already accustomed to that type of stimuli, and that makes your reflex. Alright, now let's move on with the anatomy. So the spinal cord will start at the level of foramen magnum. Please take note of this landmark. No, kasi the spinal cord is a continuation actually of your brainstem, specifically the medulla oblongata. Inferiorly, pag nag-continue si medulla oblongata, magiging spinal cord. Kailan siya? Papalitan ng pangalan to spinal cord at the level of the foramen magnum. Okay, now this will then terminate inferiorly according to Snell at L1 vertebra. Other books kasi L2, but let's follow Snell muna for now. L1 vertebra, end na si spinal cord. Because it will then change into what we call coda equina. Magiging spinal nerve roots na siya, no? Coda equina, which literally means horsetail. Kasi mukha na siyang buntot ng kabayo, no, yung coda equina, which is the spinal nerve roots of your lumbosacral plexuses, which we will also discuss as we go along. Okay. Now, we have 31 pairs of spinal nerves. Nababanggit ko na yung spinal nerve roots. So, these are nerves that will arise from the spinal cord itself. No? So, we have again 31 pairs, and they are classified or divided into categories. We have the cervical, the thoracic, the lumbar, and the sacral. And all in all, we have 31 pairs. Left and right yan, no? And then it's enclosed inside the vertebral canal. Please do not be confused with the names, no? Kasi there are intervertebral foramina, meron tayong vertebral canal, meron tayong central canal, meron tayong spinal canal. So madaming canal, no, na names within our body. But for the spinal cord specifically, nasa loob siya ng vertebral canal. Vertebra is the bone itself, no, yung spinal column natin, yung napapalpate nating buto, that is the vertebra, buto. So the vertebral canal is a structure of the bone. No? So enclosed there inside is the spinal cord. Okay, so just a recap lang of your anatomy of the skull. So in this view, this is anterior view. Can we see the foramen magnum? Yes or no? In this view, we cannot see the foramen magnum. How about in the lateral view? Kaya na ba? Can we appreciate the foramen magnum? Still no. Okay, how about this one? Eto na, kita na natin siya. Yung butas na yan, yung highlighted na green part there, that's your foramen magnum. Um, it's the biggest opening, no, in our skull. So that's your foramen magnum. Again, it's the start of your spinal cord. Right, so this picture shows you the vertebral canal. So this is where, again, the spinal cord is enclosed. Iba to kay intervertebral foramina, which is this one. The intervertebral foramina, from the name itself, it's in between vertebras, dalawang vertebra, may butas. Foramina or foramen, those are the same thing. Some books, they use the term foramen kasi. But personally, I like to use the term foramina kasi smaller, meaning smaller yung opening niya compared to other canals, no? And it makes sense kasi mas maliit yung structure na mag-exit doon sa intervertebral foramina natin, which are your spinal nerves. Right? Sabi ko kanina, ang spinal nerves, these are nerves or nerve roots that will arise from the spinal cord. So pag humiwalay na sila sa spinal cord, mag-exit sila sa intervertebral foramina, which they will continue as a peripheral nerve na. We'll discuss that sa next na topic nyo, sa peripheral nervous system. Okay, so aside from those anatomical landmarks, meron pang isa, yung conus medullaris. The conus medullaris is the cone-like shape region of your spinal cord. So here, it's at the level of L2. Sabi ko kanina, no, kay Snell, the spinal cord ends at L1. That's correct. This one I'm using Sealy naman as a reference. Kaya sabi ko may L1, may L2. Let's just follow L1, L2. I-range natin siya. But basically, the conus medullaris is the inferior part still of your spinal cord, but specifically named as conus medullaris. I have a picture here where you can appreciate more the conus medullaris. May cone shape siya, parang cone ng ice cream. Ayan. Okay, next is we have the three meninges. The meninges is the one that surrounds, covers your central nervous system. So when we say central nervous system, dalawang structures dapat ang papasok sa isip natin, no? It's the brain and the spinal cord. So not only the spinal cord is covered by the meninges, but also the brain, no? So we have three. You have the dura mater, pia mater, and the arachnoid mater. Actually, hindi magkakasunod-sunod yung pagkakalagay ko dito. But if we follow from the outermost layer or the superficial layer, it's the dura mater, and the next is the arachnoid mater, and then the innermost layer is the pia mater. Okay, please do not forget the correct sequence of the meninges from superficial to deep layer. And then the spinal cord, same with your brain, is protected by the CSF, which is contained in the subarachnoid space. That's why we have to mention the meninges kasi in between the meninges, may palaman sila. And that's hindi palaman, sorry. May mga spaces sila. Okay, and that's called your may kanya-kanya silang names. No? For example, underneath your dura mater or sandwich between your dura mater and arachnoid is your subdural space. Sandwich between your arachnoid and your pia mater is called your subarachnoid space. Okay, so yun. Their name is according to their location. And so here is another picture of the meninges covering the spinal cord. Ayan, another picture pa, just to better appreciate the three meninges. Again, innermost is the pia mater, in between is the arachnoid, and then outermost is the dura mater. Okay, so let's have a more specific discussion on the meninges. Na-mention ko na kanina yung mga spaces in between, no? So let's go back. Before the dura mater, there's another space, and that's in between the skull, yung mismong buto, and the dura mater, and that is called your epidural space. I'm mentioning this because it has a clinical significance when it comes to women who are giving birth, no? Dito, ini-inject yung anesthesia nila, yung epidural anesthesia. Okay, it's at the epidural space and usually sa may inferior end ng spinal cord, which is the level of L1, L2. Okay, this is and then after that, you have na the dura mater. Okay, so the dura mater is the superficial layer of the meninges, and then underneath your dura mater is the subdural space. Okay, sa subdural space, there are certain structures that are contained there, such as your dentate ligament. Other books, they name this as denticulate ligament. So that's the same. Now, so si dentate ligament, just like the other function of your ligament, it's to protect and stabilize a structure. So specifically in the spinal cord, ang sinastabilize niya is, of course, the spinal cord. So naka-hold yan within the subdural space. Nakahawak siya sa spinal cord, making sure na hindi gagalaw, no, or stabilize basically si spinal cord every time we do movement, no, especially when we perform trunk motions. Okay, but aside from dentate ligament, meron din tayong isa pa, which is the phylum terminale or phylum terminal, no, which is a ligament also that has the same function with your dentate ligament. Magkaiba lang sila ng location. So si dentate ligament nasa may subdural space, si phylum terminale, from the name itself, nasa pinakadulo ni spinal cord. Siya yung parang buntot sa picture. Right, so both of them again is for stabilization of the spinal cord. It tightly enclose or tightly make sure that the spinal cord is tightly within the vertebral canal. Okay, next is the arachnoid mater, which is in between your dura mater and the pia mater. So underneath your arachnoid mater is your subarachnoid mater. Now, subarachnoid mater, pinaka-importante sa lahat because this contains your cerebrospinal fluid, which functions as shock absorber, no? So, si CSF, meron din tayo sa brain yan. Kung wala yan, no, konting galaw lang ng katawan natin is tumatama agad yung structures na yung brain and spinal cord natin, tumatama agad yan sa buto. No, but because we have CSF, may fluid tayo, it serves as a cushion in between the bone and the spinal cord. And that is located within the subarachnoid space. And then lastly, we have the pia mater, which is again the one that is connected or directly covering the spinal cord. Okay, so I have summarized na here the importance of each spaces, no, for reiteration. So do not be confused with dentate and denticulate ligaments. Those are the same. Ayan. So here's a picture of a cadaver showing a thoracic spinal cord. Denticulate ligament is the whitish part here. That's your denticulate ligament, no? So it's the one that will tightly hold the spinal cord in place. Anong space nga ulit si denticulate ligament? It's within the subdural space. Ayan. Si phylum terminale is this one. Yung pinakadulo ng spinal cord. Alright. So now let's go to the spinal cord itself. Pag hinati natin si spinal cord, we have a cross-section view. Now let's divide the spinal cord into two parts. We have the anterior part and the posterior part. Anteriorly, meron tayong deep longitudinal fissure. Please do not forget this, na ang deep longitudinal fissure, deep, ibig sabihin, mas malalim yung kanyang hiwa, no, ay makikita anteriorly. It's located anteriorly, the deep longitudinal fissure. Why am I emphasizing this? Because it's a great landmark to identify the laterality of your spinal cord. Kasi pag nakita nyo, like for example in this picture, yung purple na picture, saan dito yung mas deeper yung fissure? It's this one, diba? So now, because we know that this is only located anteriorly, alam natin na ito yung harap ng spinal cord at ito yung likod. Okay? So, Next is anteriorly, we also have the motor roots. Okay, later yan, we'll have a thorough discussion. Okay, following also the somatotopic organization of the spinal cord, lahat ng nasa harap ay for motor function. Lahat ng nasa likod, posteriorly, ay for sensory function. Okay, please do not forget also that that's under your law of Bell and Magendie. Again, lahat ng nasa anterior is for motor function. Lahat ng nasa posterior is for sensory function. Okay, now let's move on with the posterior part. So, we have, kung meron tayo sa anterior ng deep longitudinal fissure, also known as anterior median fissure, we have in the posterior median fissure, which is more shallow compared to the deep longitudinal fissure. Aside from that, we also have sensory roots. No? So again, sabi ko kanina, following the law of Bell and Magendie, posteriorly, these are sensory in function. No? So we have the sensory roots posteriorly. Next, and the most important landmark for the posterior division of the spinal cord is the dorsal root ganglion. Some books, they name this as posterior root ganglion. That's the same. When we say dorsal, other name to ng posterior. Anterior, other name niya is ventral. Okay? Ayan. So, dorsal root ganglion is yung pinaka-chunk. Yung nakikita nyong mataba dito. Ayan. Yeah, this one. Yung matabang part na yan ng spinal cord, that's your DRG or the dorsal root ganglion. Kaya yan ganyan ka-chunk is because madaming cell bodies dyan. If you may recall, when we say ganglion, it means a collection of cell bodies in the... Saan ang ganglion ginagamit? Peripheral nervous system, central nervous system. It's at the peripheral nervous system. Right? And that's correct. No? Kasi DRG, yung part na yan ng spinal cord yan is papunta na yung peripheral nervous system. That's why ganglion is actually a correct term. Okay, what do we call a collection of cell bodies in the central nervous system? That's your nuclei. No? So, kung ganglion for peripheral nervous system, nuclei naman kay central nervous system. Alright. Now, here's another picture of a detailed anatomy. Pag-uusapan natin tong mga tracks na to. And I hope that at the end of this lecture, you really appreciate the location of these tracks kasi it's very important, especially in your laboratory session. Okay, so ang pinaka madaling makitang track dyan is the dorsal column track. No? Itong dalawang to, nasa likod. That's your fasciculus gracilis and fasciculus cuneatus. Palatandaan ko nung student ako, kasi kailangan yung i-identify sino yung nasa medial. Sino tong mas malapit sa medial, mas malapit sa gitna, or the medial one. That's your fasciculus gracilis or gracilis, no? Palatandaan ko is GM. Ewan ko. So, letter G stands for gracilis, M stands for medial. So, kahit isa na lang tatandaan ko kasi sure na ako na yung cuneatus nasa may lateral part. Okay. So, pwedeng GMCL. Okay. Ayan. And then we have, kita na ba dito? Si lateral corticospinal tract, isa pa yung important na tract. Corticospinal tract, it's the descending pathway responsible for our movement. No, kung wala yan, hindi masasend ng brain natin sa kamay natin, for example, na gumalaw siya. Okay, so it's via the corticospinal tract. It's a descending pathway. That's a motor tract. Ang dorsal column medial lemniscus or yung fasciculus gracilis and fasciculus cuneatus, these are sensory naman. Does it make sense? Nasa likod sila. So, sensory ang kanilang function. Yes, no? Alright. Okay, now let's talk about gray matter and white matter. Same with the brain, no? Meron tayong gray matter, meron tayong white matter. Opposite siya kay spinal cord, no? Si spinal cord, ang loob niya ay gray matter. The inner core is gray matter because, di ba kaya kulay gray? yung gray matter is because it's a collection of cell bodies. Nandyan lahat ng mga cell bodies. So, mga bilog yan, di ba? Pag nakita nyo sa microscope, sila yung very contrasting yung kulay nila. So same din with gray matter and white matter, sila naman yung mga nerve fibers, tracts, axons, no? And the reason why they are whitish in color is because of their myelin sheath, the lipid substance that covers the axons, diba, creating a saltatory conduction, allowing action potentials to jump from one myelin sheath to another. Kaya mas mabilis yung rapid fire, mas mabilis, mas rapid yung firing ng action potentials along the axons. It's because of the myelin sheath. And kaya din color white siya. Okay, again, pagdating sa spinal cord, the inner core is gray matter. Kasi may mga cell body yan. Yung parang butterfly, yan. Yan yung mga cell bodies na pag-uusapan din natin as we go along. Kung ano-ano yung mga cell bodies na yon. And then the outer core is the white matter kasi mga tracts yan. Kanina na-mention na natin yung corticospinal tract and yung dorsal column medial lemniscus tract. So, ang tract, it's a term that we use to describe a collection of nerve fibers. No? Ginagamit yung term na tract. So, basically, mga nerve fibers lang siya. Plural ng nerve fibers. Alright, so here's another picture. Again, no, this is the DRG located posteriorly. Si deep longitudinal fissure located anteriorly. And then we have the spinal canal. O iba si spinal canal kay vertebral canal. Kasi si vertebral canal ay ito, tinatakpan ng taba. Ayan. Yung butas na yan is the vertebral canal. Ano to? This one is the vertebral body. How about this one? This is the spinous process. And this is the transverse. Papuntang transverse na to. Transverse process. Alright. Again, saan si gray matter? Inner core, outer core, inner core. Okay, and which is the white matter? The outer core. Saan dito ang anterior? The anterior is this one. Ito yung harap niya. Kasi that's the deep longitudinal fissure. Alright, so let's move on first with the gray matter or the inner core of the spinal cord. Okay, so the gray matter, again, this is the collection of cell bodies no, within the spinal cord. It looks like a butterfly kanina, but it's also a H-shaped pillar. It's divided into two columns. Meron tayong anterior gray column and posterior gray column. Pero, para na lang hindi tayo malito, kasi meron din sa white matter na mga columns. Gamitin natin yung horn. No, kasi mas mukha siyang horn. Okay, so let's use the term horn. So we have anterior gray horn and the posterior gray horn. Okay. Now there are some areas or some level or segments of the spinal cord that also has a lateral gray horn, and those are only present in the thoracic and the upper lumbar segments of the cord. The rest wala tayong lateral gray horn. Okay. Next is the gray commissure. So the gray commissure is the one that connects the two horns and it contains the central canal or the spinal canal. O, central canal yung gamitin natin. Okay, so yung gray commissure natin is etong tulay na to, yung transverse, yung transverse line ng ating gray matter. Okay, next, let's go to the anterior muna, anterior gray horn. So the anterior gray horn, sabi natin kanina, following the somatotopic organization of the spinal cord, lahat ng nasa harap is for motor function. Another term for motor is efferent. Efferent, another term pa rin, is descending tracts, no? Sabi nga natin, lahat ng descending, pababa, no? Mag-create yan ng action, ng motion, ng movement, ng contraction. And that's an example of a motor function. Okay? So aside from that, this also has a large multipolar cell bodies because mga motor to motor nerve cells, no. Mas malalaki kasi ang nerve cells ng motor. Okay, the nerve cells are divided into three basic groups or columns. You have the medial, central, and lateral. Okay, but ang mas kailangan natin tandaan is yung somatotopic organization ng spinal cord. But the medial group, this is present in most segments of the spinal cord, and this one is responsible for innervating the skeletal muscles of the neck and the trunk. This is following also, again, the somatotopic organization kasi ang Ang medial, para siyang sa brain natin, 'di ba? Yung brain din has a somatotopic organization. Yung medial structures ng brain natin is more on the face, ang kinokontrol, face and the hand. Same with the spinal cord, meron din siyang somatotopic organization in which yung medial um, side or inner part, layer ng spinal cord is responsible for controlling the neck and the trunk. And then palabas ng palabas, or papuntang periphery, next is the upper extremity, and then last would be the lower extremity. So yung lateral na somatotopic organization ng spinal cord controls the lower extremity, which is why the lateral group of these nerve cells are responsible for controlling the lower extremity naman, or the limbs. Okay. Next is the posterior gray horn. So sabi natin, posteriorly, these are sensory in function. So it contains afferent naman, no? Afferent, also known as ascending tracts or ascending nerve fibers. So these are all for sensory functions. Okay, examples ng mga nerve cells. Sorry, wag natin gawin yung nerve cells. Example ng mga cells no, would be your substantia gelatinosa, nucleus proprius, nucleus dorsalis or your Clark's column, and then the visceral afferent nucleus. And these are all the names ng mga cell bodies na makikita natin sa posterior horn. Okay, at iisa-isahin natin yan according to Rexed's laminae. Okay. So the Rexed's laminae basically is an organization of the cell bodies within the gray matter. No, so there are superficial laminae and deeper laminae. But basically numbers to, laminas 1 to 9. Lahat ng nasa posterior still for sensory function. So magsa-start tayo with lamina 2 actually ang start nito, which is the substantia gelatinosa, also known as substantia gelatinosa. This one is the cell body responsible for receiving afferent tracts or afferent nerve fibers that are sending painful stimuli. Yung mga pain, no, sila yung nakaka-receive ng signal. We'll discuss the other laminae as we go along. Okay, so let's start with lamina 1 and lamina 2. So both of these are for pain, no? So lamina 1 contains neurons that responds to noxious stimuli via contralateral spinothalamic tract. Specifically, it's the lateral spinothalamic tract na didiscuss din natin, unfortunately, here sa spinal cord, no? Kasi under niya yon. Okay, so pag sinabi nating noxious stimuli, this is anything that causes tissue damage. Kaya tayo nasasaktan, no? Kasi nagkakaroon na ng tissue damage doon sa area na yon. That is the receptor responsible for receiving that input or stimulus are the nociceptors, no? Then we have the substantia gelatinosa. Palatanda namin dyan is substantia gelatinosa, lamina 2. So this is also responding to noxious stimuli. Now, may sinulat akong substance P. So, I mentioned lang substance P, which is responsible also for, this is a neurotransmitter, no, responsible for pain. Nagre-release tayo ng substance P kapag merong pain. Okay, next is, so, laminas 3 and 4, also known as your nucleus proprius. So this one is for position and light touch sense. Specifically, this is for proprioception. So medyo madali siyang matandaan, no? Kasi it sounds like proprioception, proprius. Next is the lamina 5. So this one is also for noxious stimuli and visceral afferent stimuli. When we say visceral, this means sensation of the internal organs, no? Okay, lamina 6. This is the deepest layer, and this one is for mechanical signal from joints and skin. So somehow similar sila ni proprioception with proprius, nucleus proprius. But this one is specifically found in the joints and in the skin. Next is lamina 7 or your Clark's column. This one will be thoroughly discussed in your autonomic nervous system because the main function of this lamina is it serves as a preganglion of your sympathetic nervous system. So we'll discuss this again with your ANS, autonomic nervous system. Next is laminas 8 and 9. So this is the start of the motor neurons na in the Rex's laminae. So this represents the motor neuron groups in the medial and lateral portions of the ventral gray column. And if we go back, no, when we mentioned already the somatotopic organization of your spinal cord, yung kinokontrol na body parts ng nasa may medial zone ng spinal cord would be the cervical or the neck and the trunk. And then the intermediate zone is for the upper extremity. And then next would be the lateral or the periphery na, which is for the limbs naman. Okay, or the lower extremity. And last is lamina 10. So lamina 10, this is a small neuron around the central canal or its remnants. Next is the lateral gray column. Sabi natin kanina, this is only present in the thoracic and the upper lumbar segments of the spinal cord. Now, ang main function ng lateral gray column is sa autonomic nervous system. So, babalikan natin to pagdating nyo sa ANS, no? Because this is where the preganglionic sympathetic fibers will arise from. Okay, so hindi ko na masyadong i-discuss itong part na to because again, sa ANS to. Now, next is the transverse gray commissure or simply the gray commissure. I've mentioned this already. This is the one that connects the anterior and posterior gray horns. No, ito yung nasa gitna na parang tulay, the bridge. Wait, let me just... Okay, this one, no, that's your gray commissure. In between, yung pinakagitna, no, the middle portion of the gray commissure has a central canal. So, this one is continuous all throughout the spinal cord. Okay, hindi lang to in a certain area like yung lateral gray column natin or lateral gray horn. Your central canal, again, this is continuous all throughout the spinal cord. And then inferiorly, no, yung central canal, kaya tayo merong conus medullaris is because that will be the end. No? Kaya yan medyo may bulge siya na shape. It's because of the central canal. Okay, next is the white matter. So we're done with the gray matter. Let's now move on with the outer core. Again, white matter, kaya siya white. It's because these are collection of axons or nerve tracts or nerve bundles. Lahat ng may kinalaman sa nerve fiber, no? And the reason why it's white is because of the covering of myelin sheath, which is made up of lipids, no? And pag nakita natin siya, it's whitish in appearance. Okay, just like your gray matter, this is also divided into columns. We have the anterior, posterior, and the lateral white column. Kaya, sabi ko kanina, gamitin na lang nating term for the gray matter, yung horns, no? Para hindi tayo malito. Okay? So, ganun pa rin. We still follow the somatotopic organization. Lahat ng nasa anterior will have a motor function and lahat ng nasa posterior will have sensory functions. Okay, paano naman yung lateral? Lateral, sometimes, no, this is the one for autonomic nervous system. Yung mga preganglion na na-mention ko kanina or earlier, that's mainly, commonly, the function of those structures found in the lateral portions. Ayan. So, we have already answered why is it color white. It's because of the appearance of the myelin sheath. Ayan. It's covered by myelin sheath, which is produced by sa central nervous system. Sinong neuron ang produce ng myelin sheath? That is your oligodendrocytes. Sa peripheral nervous system, it's the Schwann cell. Sabi ko neuron, no? Hindi. Neuroglia. It's a type of neuroglia. Your Schwann cell and your oligodendrocytes for CNS, and then Schwann cell for the peripheral nervous system. Okay, so this is just another picture to show a model of your spinal column. And you can see the dorsal root ganglion, yung pinakamadaling i-identify sa lahat, no? And again, this is part of the posterior portion of the spinal cord. Pero guys, ha, just to clarify, this is really the portion of your spinal cord. Ito is spinal cord. Okay? Pag itong dalawa ay nag-meet na, so this is the posterior spinal root, nerve root. This is the anterior spinal nerve root or the ventral spinal nerve root. Pag nag-meet sila together, itong kabuuan na to, this is already your spinal nerve roots. Okay? Nerve roots na ang tawag natin dyan. Nerve roots. Spinal nerve roots. And that is the start na of lower motor neuron na classification. Ang endpoint kasi guys, no, I guess this is the first time I've mentioned upper motor and lower motor neuron, is yung anterior horn cell natin. If we recall, no, ang anterior horn is this one. Sabi ko cells, so dapat nasa gray matter yan. So anterior horn cells will be the endpoint ng upper motor neuron. Okay? Pagdating yan, beyond anterior horn cells, magiging classification nila is lower motor neuron. So lahat ng magpapass through here, palitan natin yung color, lahat ng magpapass through here, even here ha, is part na of a lower motor neuron classification. This is applicable for motor function. Okay, motor neuron, no? So here, pag pataas, lahat ng manggagaling from the brain spinal cord up to the anterior horn cell is still considered an upper motor neuron. Okay, so anterior horn cell is a very important landmark to identify kung ano pang classification ng motor neuron nila. So this slide shows us a summary of the structural details in the segments in different regions of the spinal cord. I won't be reading all of this na since you can have this copy this is in Snell. Naka-summarize na siya in a table. So I'll just mention yung mga special na characteristics per segment. So for cervical region, among the segments, no, siya lang yung may shape na oval in shape because the lumbar area is sometimes oval or round. No? So round to oval yung shape niya, but the cervical segment has an oval shape. And then cervical and sacral, these two, the cervical and the sacral, wala silang lateral gray column, no? Negative, negative. Because we've mentioned that the lateral gray column is only present in the thoracic and upper lumbar segments. Alright? Ayan. And then, all of them will have yung ating posterior columns, ang ating fasciculus gracilis, ang ating palatandaan is G, M, so this one is at the medial portion, yung nandito, and then the fasciculus cognatus, CL naman, no, si CL, so the lateral column. Okay, and then the anterior horn cells is found here. Your corticospinal tracts are found on the lateral side, no? Medyo pa-anterior. And then you have the spinothalamic tracts. The spinothalamic tracts is, meron tayong dalawang fibers kasi we have the anterior spinothalamic tract, so around here. And then we have the lateral spinothalamic tract, so maybe around here. Okay? Basta visually, medyo may sense naman, no? Kung saan yung mga locations ng mga tracks. Alright? So, ang important lang here, I think, would be the presence of the lateral gray column. Alright, so let's have a quick recap of the identification. Please be familiar with this. Kasi pagdating nyo sa laboratory session, you'll still have identification of the parts. And malay nyo, magkaroon ng moving exam, no? So, kailangan familiar kayo dito. Kasi pwedeng ito yung mga tanong sa exam nyo, sa moving exam. So, number 15. Number 15 is... Asan si number 15? 15. O, dito muna tayo. This is itong pinaka-chunk na yan, that's your dorsal root ganglion. Number 18. 18 is this one. So, 18 is the posterior root or the dorsal root. Ay, sorry. Posterior root or the dorsal root. Okay. 17 is, yung opposite niya lang, this is the anterior root or the ventral root. Collectively, they are called your spinal nerve roots. And I guess my next question is, upper motor neuron or lower motor neuron na to? This is considered under lower motor neuron. Again, lower motor neuron. Number 37. Number 37 is this one. So, that could be the lateral gray horn. So, kung may lateral gray horn, pwede itong cervical. Pwede itong thoracic, no, segment. Thoracic segment of the spinal cord. Okay. And then, number 36 is the anterior gray horn, kung saan makikita ang anterior horn cells. Okay. And then 38. Number 38, this one, posterior gray horn. Diyan naman makikita ang ating pwedeng substansya gelatinosa, mga cell bodies for sensory function. Number 33. Asan si 33? This one. Okay. So, this could be the cortico-spinal tract. Okay. Kasi white na yan eh. Under na siya ng white matter. So, mga tracts na yung pinag-uusapan natin. Number 30. 30 is this one. This is the anterior white column. Or, paano kung mga tracts yung tinatanong? Pwede tong si anterior, sino kaya to? Anterior spinothalamic, no? Pwede tong si anterior spinothalamic. Okay, and then 32. Asan si 32? Ayun. 32, this is fasciculus gracilis or cuniatus? Gracilis. Okay, 25. 25 is this, o yung nasa may posterior, this is the posterior median fissure. Okay. Ay, sorry, 25. Mali. Mali yung nakita kong number. Bura, 35 pala yung nakita ko. Ayan. So, 25. Sorry, ibang number yung nakita ko. 25. That is the anterior median fissure. 23. Yun. Si posterior median, hindi na siya fissure kasi mas shallow siya. So, posterior median sulcus. Okay. And 35, ito yan, yung 35, that's the central canal. Paano kung ito, yung bridge, yung tinatanong, that could be the gray commissure. Kung itong kabuuan na yan, no? Alright, so I hope na nakasabay kayo sa akin habang ina-answer yung mga locations or landmarks, no? So here's another one without all the labels. So try to answer, try to memorize the landmarks, no? Especially yung mga location ng mga tracks. Please be mindful of those. Alright, so now let's move on to the nerve fiber tract arrangement. Ito na yun, yung mga mini-mention ko kanina, no? Ayan, sabi ko nga kanina, the corticospinal tract is found here. Nasa may posterior, lateral na lang, para hindi tayo malito. Sa may lateral area ng white matter. Kasi mga tracts na yung pinag-uusapan natin. Next is the spinothalamic tract. It's on the anterior and the lateral spinothalamic tract. Dalawa kasi yung fiber ng spinothalamic tract. Okay, and then we have the fasciculus gracilis and the cuniatus, pinakamadaling ma-identify, no? And then yung mga spinotectal, spinocerebellar, be familiar with them as well. Pero ang pinaka-common kasing mga tracts would be yung mga minention ko, corticospinal tract, your dorsal column, which are your fasciculus gracilis and cuniatus, and the spinothalamic tract, anterior and the lateral fibers. So, three divisions, no? The three divisions are the ascending, descending, and intersegmental tract. Under ni ascending meaning afferent for sensory function, these are your spinothalamic tract. Example niyan is spinothalamic. Itong lahat ng magsa-start sa spinal cord, spinorectal, spinotectal, spinoolivari, spinocerebellar, those are all ascending tracts. Okay? What else? Your fasciculus gracilis and cuniatus. Kabuuan nito ha, this is also called your dorsal column. Okay, so kaya malilito pag hindi ginamit si fasciculus gracilis and fasciculus cuniatus kasi yung haba no? Dorsal column, sila din yun. Okay, how about the descending tracts? Pag descending tracts, sila yung efferent na function. E meaning ine-exit, no? Nagbibigay ng effort, sila yung nagpapakontract ng muscles. Ito yung mga motor function. Motor function. An example na lang nito ay yung nag-iisang corticospinal tract. That's an descending tract. Galing sa cortex from the brain, papuntang spinal cord, nag-descend, that's your descending tract. Intersegmental tracts, meaning yung mga nerve fibers within the spinal cord lang. And ang mga example nito ay nasa autonomic nervous system. No? So, saka na natin pag-uusapan si intersegmental tracts. So, let's just be familiar first with the two, ascending and the descending tracts. Let's start with the ascending tract. So, these are sensory nerve fibers that are segregated into nerve bundles or tracts. Kaya siya tracts kasi madaming, it's a collection of nerve fibers. Collection. Okay, connect spinal cord to the brain, also known as afferent tract. So, from the spinal cord, papuntang brain. Okay, and it contains sensory or afferent information such as your exteroceptive and the proprioceptive. Ang difference lang nito is exteroceptive meaning external, no, nanggagaling sa external yung sensory input. Environment, no? So yung mga mechanoreceptors natin such as for heat, temperature yan. For temperature, for pain. Yan ang example ng exteroceptive. Proprioceptive, meaning it's inside the body. Okay? Nare-receive niya yung mga sensory input inside the body. Example would be sa joints, sa ligaments, and sa muscles. Yan. And very important to for the reflex mechanism. Alright. Now, let's go to the anatomical organization. Wag niyong kakalimutan itong order neurons natin. We always start with the first order neuron. So, dahil ascending to, magsa-start tayo sa may spinal cord, no? But, specifically, sa may dorsal root ganglion. Okay? So, si first order neuron is the dorsal root ganglion. Okay? Na makikita ulit sa may posterior nerve root, no, or posterior root of the spinal cord. Okay? Yung mga order neuron na yan, ibig sabihin lang saan magsa-synapse yung action potential papuntang brain, no? Saan yung pathway nila. So, magsa-start sa may DRG, and then ang second order neuron, if this is for, magbigay tayo, so spinothalamic tract. So, kunyari pain. Oh, pain. For pain to ha, ito yung sensation na i-send niya sa brain. Ito yung nararamdaman ng balat, no? Kailangan ma-receive ng brain na may pain. Okay? So, the first order neuron is the DRG. Second order neuron, na-mention na natin to sa mga lamina. Within the spinal cord, sino ulit yung cell body responsible for pain? That's your substantia gelatinosa. Or lamina 2. Okay. So, that's your second order neuron. So, pagdating niya sa DRG, for example, ito yung ating spinal cord yan ha. Spinal cord, spinal central canal. Okay, you have the DRG here. Okay, tapos ito yung sa... Yan. For example, the first order neuron is here. O, diba? Yung sensation na naramdaman, dito muna siya magsa-stop over. Yan yung jump off point. Okay, and then next is magsa-synapse yan sa may substantia gelatinosa, sa may gray matter. Next, so that's your second order neuron. Last, yung third order neuron. So, aakyat yan, no? Ascending, papuntang brain. Pero bago yan pupunta ng brain, pupunta yan sa sensory receiving structure ng brain natin. And that's your, sino tong area na to? Thalamus. Lahat ng sensation ay dadaan muna yan kay thalamus bago niya papasukin sa brain. And specifically, anong nucleus, anong cell body ni thalamus ang magre-receive ng sensory input? It's the VPN or the ventroposterolateral nucleus of the thalamus. Sulat natin. VPN, no? So, ventral posterolateral nucleus of the thalamus. Haba. So, VPN na lang. Okay. So, this one will receive the input. If this is body body yung nakaramdam. Kasi iba yung for the face. That's the ventral posteromedial. Anyway, saka na yun, sa somatosensory cortex. But, for this one, it's the VPN or VPL. Para matandaan nyo yung lateral. VPL. Okay, ventral posterolateral nucleus of the thalamus. So, that's the third order neuron, si thalamus. Tapos, pupunta na yan sa brain. Anong area ng brain? Sinong cortex? Anong lobe? Lobe muna. Ang lobe natin is the parietal lobe for sensation or the somesthetic area or somatosensory area. Pare-parehas lang yon, iba-iba lang ng names. Depending kung anong textbook ang ginamit. But parietal lobe. Specifically, anong Brodmann area number? BA, Brodmann area 3, 1, 2. Okay? So, I hope na nakaka-catch up kayo. First order neuron is the DRG. Second order neuron is the lamina. Depending kung anong type of sensation. But kunyari nga pain. So, lamina 2. Third order neuron is the VPL of thalamus. Nucleus of thalamus. So, lahat ng mga order neuron na yan are cells, no? Cells yan. Kaya siya neuron. Hindi naman track yung ginamit natin. Okay, and this is the one that we follow for ascending tracks, no? Kasi pagdating natin sa descending tracks, wala na yung mga order neuron na yan. Instead, ang meron na tayo is upper motor neuron and lower motor neuron. Alright? So, here's another picture showing the order neurons, no? The pathway for ascending tracks. DRG ang start. First order neuron. Second order neuron is the lamina. And then the third order neuron is the thalamus. Eto, guys, huwag kayong malilito ha. Ma'am, dito bakit iba ata yung first order neuron? This is a different track. So, ang ginagamit dito is the, sulat natin, dorsal column, medial lemniscus tract, or yung fasciculus gracilis and cuniatus natin. Kasi different yung sensation na nire-receive nito, which is proprioception and discriminative touch. Iba yun sa pain and light touch. No? Siya yung mas distinct na type of sensation. So, si DCML tract, iba to, iba yung dadaanan niya or iba yung pathway niya compared to spinothalamic tract, yung kaninang example natin. Look at here. Yung first order neuron niya is, the first order neuron would still be the DRG. Mali yung nasa picture, no? So, first order neuron natin still is the DRG. Ito yan. Okay? Wait. So, this is the first order neuron. So, mali to. Ito yan. Okay? First order neuron is still the DRG. Itong pinapakita tong touch receptor, that's the receptor. So, mechanoreceptor na naka-receive nung input. Tapos, yung receptor na yon, siya yung magsisend sa first order neuron, which is the DRG still. Second order neuron, ito yung magbabago, no? Kasi 'di ba, ang second order neuron ng spinothalamic is lamina 2 or kung ano mang sensation 'yon. Basta nasa gray matter, gray horn. Kay DCML tract, ang second order neuron niya is nasa may medulla. Okay? Medulla. Specifically, kung upper extremity to, ang kanyang second order neuron is the cuneate nucleus. Okay? If this is for upper extremity, palatandaan ko is may letter U, upper extremity yan. Pag naman ang sensation ay na feel or na ang limb na responsible for that is the lower extremity, ang makaka-receive naman nun is the cuneatus or cuneatus gracilis. Palatandaan ko dyan may letter L for lower extremity. O kunyari parehas na lang, naka-feel, no? Upper extremity and lower extremity. So, dalawang yan, magsa-synapse yung fiber na nanggaling sa dorsal root ganglion. Okay, so the first order neuron is the DRG. Second order neuron is either the cuneatus gracilis or cuneatus fasciculus, which are located in the medulla. Again ha, medulla, hindi sa gray matter ng spinal cord. Okay, so medulla to. Sa medulla, DRG. And then, saan yung third order neuron? Parehas na, no? Ito ay sa may thalamus. Okay? Thalamus. Sino ulit yung sa thalamus? That's the VPL or the ventral posterolateral nucleus of the thalamus. So, nag-iba lang sila sa second order neuron. Ayan. So, again, what are the function of the ascending tracts depending on the tract, no? So, pain and temperature, light touch and pressure, these are for the spinothalamic tract. Pero may specific na fiber yan, ha? Pag pain and temperature, that is the lateral fibers of the spinothalamic tract. Pag light touch and pressure, that's the anterior spinothalamic tract. Discriminative touch and vibration, na-mention ko na, it's the DCML tract or yung ating fasciculus gracilis and fasciculus cuneatus. Okay, and then you have muscle joint sense via the cerebellum. Yun yung mga spinocerebellar tracts. And then other ascending pathways for extrapyramidal function. Example na lang would be the spinotectal. Yan. So those are examples of your ascending tracts. Now, here is a summary. Nakasummarize na sa table kung ano yung receptor, first order, second order, and the third order neuron. Okay, please take note. Iba yung second order neuron kay discriminative touch. Again, no, it's the nuclei gracilis and cuneatus which are located sa may medulla pa. Okay. And then the rest, pare-pares na silang ventral, posterolateral nucleus of the thalamus. Actually, kahit ito na lang yung, kung hindi nyo na-gets, pag visualize nyo, ako kasi ganun ko siya na-memorize, no? Pag visualize ko yung pathway, kung mas okay sa inyo to, then kahit ito lang, no, buhay na kayo dito sa table na to. Here's another table. This one is from Waxman naman. Kanina is from Snell. These are the other tracts, ascending tracts. No? You have the spinocerebellar and the spinoreticular. Meron pa yung spinotectal. Ayan. Spinotrigeminal. Madami pa, no? Alright, so let's start with the lateral spinothalamic tract. Mabilis na to kasi ito din yung mga nasa table na. So, spinothalamic tract. So, spinothalamic tract, no, this is again responsible for pain and temperature. The lateral fibers, no, lateral, please, wag kakalimutan, si lateral spinothalamic tract. Where the first, second, and third order neuron. Again, first order is DRG. Second order, substantia gelatinosa. Third order is the VPL nucleus of the thalamus. What cell bodies are responsible for pain and temperature? That's your lamina 2 or the substantia gelatinosa. Which column are they located? Okay, yung column ng lamina 2 is at the posterior horn or the posterior column or the posterior gray column. Okay. Ayan. So, this one is the lateral spinothalamic tract. Okay. So, start tayo sa first order neuron, which is the dorsal root ganglion. So, first order. Drawing tayo ng spinal cord. Okay. Dorsal root. And then the anterior root. And then spinal root. Okay. Isa pa. So, this is the first segment, second segment. So, ganun ulit. Dorsal root, ganglion, and then ventral root, and then the spinal root. Okay. So, this is for pain and temperature. For example, meron tayong, napaso tayo sa kamay, no? So, unang gagawin ng nerve natin is, magsasend yan ng signal kay first order neuron. Uy, meron, napapaso yung daliri mo. So, that's a first order neuron. And then, second order neuron is, sino nga ulit yung lamina responsible for pain? That's your substantia gelatinosa. Supposedly, diba, dapat, magsa-synapse na yan dito. Tama? However, kay spinothalamic tract, iba, no? Aakyat muna siya ng 1 to 2 segments, no? Drawing ulit natin, nabura ko siya. So, aakyat muna siya. Ng 1 to 2 segments above before siya mag-synapse kay substantia gelatinosa or sa second order neuron. So, aakyat 1 to 2 segments. Kunyari ito na. Second segment lang yung gusto niyang puntahan. Or one segment above lang yung aakyat niya. Saka siya magsa-synapse kay substantia gelatinosa, which is the second order neuron. Pagdating dyan, guys, diba yung body natin is mag-receive ng input. Kunyari, right, sulta lang natin. Wag right, left na lang para follow natin sa drawing. So, left hand yung nakaramdam ng pain. Okay? So, si left hand magsasend ng input yan. Tapos, ang makaka-receive na side ng brain is the left din ba? Hindi, no? Ang makaka-receive is the right side ng brain or the right hemisphere. This is the brain. Okay? Paano nangyari yon? So, pagdating dito sa second order neuron, magko-cross siya, no? Lilipat na siya ng side via the gray commissure papuntang right side. And then sa third order neuron, which is the thalamus, doon na siya magsa-synapse. Third order, papuntang brain. Okay? So, ito yung thalamus. So, first order neuron, DRG. Second order neuron, substantia gelatinosa. Pag synapse niya ng second order neuron, magde-decassate na yan. Decassate or yung term na magko-cross over to the other side or opposite side. And then, will synapse to the third order neuron, which is the thalamus, the VPL nucleus of the thalamus. Papunta na siyang somesthetic area or Brodmann area 312 or the parietal lobe ng right side. Alright? So, that's why, kapag may stroke tayo sa right, no? Pag may stroke patient tayo, ang tinamaan sa kanya is the right side of the brain. Okay? Ito yung may stroke sa kanya. Saan siya hindi makakaramdam? sa left side ng body niya o sa right side ng body niya. Ang hindi niya mararamdaman is the left side, no? Kasi sira na to. Kasi walang nagre-receive. Ito yung, ang main cause is, sira na to, yung right side. So, lahat ng magi-input sa left side, hindi niya mare-receive. So, ang affected area kapag may right stroke is the left side of the body or left paresthesia, no, kung sensation yung problem. Alright, so I hope that's clear, no? And then, isa pang kailangan ko i-mention. Ano ang tawag natin doon sa track na nabuo niya nung umakyat muna siya ng 1 to 2 segments above? This is called your Lissauer's track. Ayan, no? So etong track na yan, kaya siya umakyat muna ng 1 to 2 segments bago yung mag-sign up sa second order neuron is because sumama siya sa Lissauer's track. Okay, ito, na-mention ko naman. Pag-akyat niya above, saka lang siya magsa-sign up sa second order neuron, which is the substantia gelatinosa, magkukross sa gray commissure. And then, on the opposite side, papunta na siyang thalamus, no? To synapse with the third order neuron, which is the ventral posterolateral nucleus of the thalamus, and then magsa-synapse na sa my brain. Alright, so that's for the pain and temperature. Again, lateral fibers yun, ha. For light touch naman and pressure, we have the anterior spinothalamic tract. Same lang din yan, iba lang ng sensation. So, start ulit tayo. First order neuron is DRG. Second order neuron is still the substantia gelatinosa. But, bago siya mag-synapse, aakyat din siya ng 1 to 2 segments. Just like your lateral spinothalamic tract via your Lissauer's tract. And then, pag nag-synapse na siya with the second order neuron, magko-cross to the opposite side. So, kung left side ulit yung start natin, nasa right na siya, no? Pagka-synapse sa second order neuron, magko-cross. Nasa right side na siya, and then aakyat ulit papuntang third order neuron, which is the thalamus. The VPL nucleus of the thalamus, and then on the right side, papunta ng brain. So, this is the right somesthetic area. Alright. So, again, here are the table, no, for your ascending tracts. And we're done now with your pain and temperature, light touch, and pressure. Pain and temperature, that's again for the lateral spinothalamic tract. Light touch and pressure is for anterior spinothalamic tract. Next is the discriminative touch, vibration, and conscious muscle joint sense, which is responsible, or the responsible tract for that is the DCML tract, or your dorsal column medial lemniscus tract, or the fasciculus gracilis and fasciculus cognatus tracts. Ayan, let's move on to the next tract. Okay, discriminative touch, meaning mas refined yung touch na nararamdaman compared sa light touch or crude touch kasi hindi mo masyado siyang ma-appreciate yung touch, no? May naramdaman ka lang. But discriminative touch, pag tinanong sa'yo kung gaano ka liit or nipis or anong texture yung naramdaman mo, pasok yan dito kay DCML tract. Kay discriminative touch rather. Okay? So, may difference tayo dito, no, pagdating kay second order neuron. With your DCML tract, same naman ang first order neuron, DRG. For example, right naman, no. Right is nakaramdam ng vibration. Alright, vibration. Sa may hand, sabihin natin, sa hand nakaramdam ng vibration. So, si right hand magsisend ng input kay right DRG. First order neuron. Second order neuron, sa may gray column ba? Yes or no? Hindi, no? Aakyat na yan agad papuntang medulla. Okay? So, kung ito si spinal cord, DRG, spinal nerve root. Okay. So, first order neuron, hindi yan magsa-synapse dito, no? But instead, aakyat siya. Okay, aakyat siya papuntang medulla. Okay? Saka lang siya magsa-synapse sa second order neuron. So, since this is vibration of the hand, kaninong nucleus siya? Kay nucleus cuniatus. Okay? Cuniatus. So, synapse. And then, ano bang lagi nangyayari pag nag-synapse sa second order neuron? Nagko-crossover, nagde-decassate. So, pag synapse niya sa medulla, magko-crossover siya to the left side. Okay? Pagdating sa left side, nag-crossover na siya sa medulla, synapse na with the third order neuron, which is the VPL, nucleus of the thalamus, papunta ng brain. Left somesthetic area. Okay? So, ayan. Yan lang yung difference niya. Second order neuron. No? So, ganun din. Kapag may stroke tayo sa left side, pag nagkaroon ng stroke sa left side, ang hindi niya mararamdaman is the right side of the body. Okay? Ayan. And example din yan would be the spinal cord injury, but that will be discussed naman in your laboratory. Alright, so now let's answer this one. Why do fasciculus cuniatus carry afferent signals from the upper extremity while the gracilis is from the lower extremity? We go back to the somatotopic organization of our spinal cord, no? Wherein the periphery, okay, yung periphery o the lateral portion of the spinal cord supplies anong segment ng body natin o anong region ng body natin? The cervical and lumbar. Actually, pa lower extremity na, no? Yan, cervical and lumbar. While, papuntang inner portion, palitan ko yung color ko. Ayan, mas malapit na sa center, ito na yung cervical region ng body natin. And then, yung pinakamalapit sa gitna or the most medial portion is sacral and lumbar. Okay? So, kung papalitan lang natin yan ng mga extremity, meaning yung somatotopic organization natin, magsa-start siya, ang sinusupplyan ng spinal cord or ang nire-represent na body part no, sa spinal cord natin is the lower extremity. And then, palabas ng palabas is the upper extremity. Okay, so ito ay upper extremity. And then, we have lumbar na for the last one. Okay, yung pinaka nasa outer periphery is for the trunk, no, or the lumbar or trunk segment ng body. And that's why, pagdating kay fasciculus gracilis, which is found on the medial side ng tract, diba, sa medial yan, sino nga ulit yung pinaka inner portion? Ang sinusuplayan nito is the sacral and the lumbar. No? So, mas malapit siya sa lower extremity. Diba? Sabi natin si gracilis, may letter L. Ang nare-receive niyang input ay from the lower extremity. Okay? While your cuneate fasciculus or fasciculus cuneatus, nasa may outer na siya, no? Nasa may periphery na siya, malapit. And that's for cervical region. Cervical, sino mas malapit? Lower extremity, upper extremity. Mas malapit si upper extremity. That's why, ang cuneatus natin is for the upper extremity. It will receive sensory input from the upper extremity. From the hand, yan. From the finger, from the hand, from the arm, shoulder, lahat na nasa upper extremity. And even the neck, no? Alright, so that's your somatotopic organization. Please be familiar with this ha. Kasi again, with your spinal cord injury, magtataka kayo, bakit itong spinal cord injury na to, tinatamaan lang is the lower extremity. Pero functional pa rin yung upper extremity. You go back to the somatotopic organization of your spinal cord. Baka naman, ito lang palang tinamaan sa kanya. Kaya yung lower extremity lang ang non-functioning. But spared yung periphery. No? Kaya meron pa rin mga nagsusupply sa upper extremity niya. Okay? So again, here's another table. This one is from Waxman naman. So these are your other fibers, no, ascending fibers in the spinal cord. You have your spinocerebellar and the spino-reticular pathway. So si spinocerebellar, this one is for movement and position mechanism, especially posture sa kanya yan. Spino-reticular, this is for deep and chronic pain naman na type of sensation. Usually these are unconscious or involuntary pathways, no? So I'm sure this will be discussed again in your somatosensory system. Alright, now we're done with the ascending tracts. Let's move on to the descending tracts. So descending tracts, also known as efferent tract. So anong ulit ang function nila? This is for motor functions. Sinong pinakasikat na descending tract? It's your cortico-spinal tracts. Kung wala tayong cortico-spinal tract, kung wala akong cortico-spinal tract, hindi ko masusulat to, no? So that's the function of your cortico-spinal tract. From the cortex papuntang spinal cord nag-descend, that's why it's a descending tract. Alright, so, descending tract, its motor neurons are situated in the anterior gray matter. Pwede ring another word na gamitin here is anterior horn cells. Okay, anterior horn cells, which is again an important landmark to identify upper motor neurons versus lower motor neurons. Okay? Kapag anterior horn cells and above, that's your upper motor neuron. Kapag anterior horn cells and below, that's your lower motor neuron. Okay? Wala na tayong i-discuss dito na mga substantia gelatinosa kasi tapos na tayo sa sensory function. Nasa motor na tayo. So, ang maririnig nyo naman is anterior horn cells. Alright? So, let's differentiate upper motor neuron and lower motor neuron. Again, kailangan nyo lang gamiting set point si anterior horn cells. So, si upper motor neuron are the supraspinal nerve cells. So, above anterior horn cells. Pag lower motor neuron, it's below or the infraspinal nerve cells where the descending tracts will synapse. No, wala na tayong order neurons here, but meron tayong upper and lower motor neurons. So, hindi na din tayo dadaan ng dorsal root ganglion, no? Kasi tapos na tayo sa sensory. So, this is a descending galing brain. Dadiretso siya sa may anterior horn cells and then papunta ng magde-descend yan papunta sa effector organ. So, kung muscle yan, sa muscle, kunyari nagsusulat ako, so muscles responsible for writing. Okay, this is where the lower motor neuron is will start, no? Begins, ayan. Tapos ito na, yan, lower motor neuron pathway na siya. Okay, ito naman is upper motor neuron pathway. So, pathways of order neuron in descending tract. Technically, guys, hindi order neurons yung tawag sa kanya pagdating sa descending tract. But, para lang ma-appreciate nyo yung similarities nila or parang yung kung ano yung counter ng descending tract kay ascending tract, pinalitan ko lang ng order neuron. So, technically, magsa-start siya yung first order neuron at the cerebral cortex. Okay? And then, internuncial neuron, parang intermediate neuron, yung magiging second order neuron nyo is the anterior horn cells. And then, the lower motor neuron is the third order neuron, which are located na sa may organ or muscle or yung effector organ. Okay? So here is a table of your main descending pathways to the spinal cord. Pinakasikat here would be the corticospinal tract. So function is for rapid, skilled, please take note, voluntary. No? So lahat ng consciously tayong gustong gawin, gustong movement, corticospinal tract. Kasi meron tayong for involuntary. No? Yung mga involuntary, it's unconscious movement. No, and those would be example, meron tayo sa vestibulospinal, rubospinal, tectospinal. Tectospinal sa mga reflexes din, no? But let's focus first with your corticospinal tract. So, this is again responsible for voluntary movement. So, dahil descending, magsa-start tayo sa cerebral cortex. Okay? From the cerebral cortex, pupunta siya ng spinal cord, magsa-synapse kay anterior horn cells. And this is the pathway for the upper motor neuron. No? From the anterior horn cells, bababa na siya papunta doon sa muscle or sa effector organ. And that is your lower motor neuron pathway. Okay. So, for example, no, sa muscle yung pupuntahan niya. Ito yung example na pangalan ng neuron na yon. Gamma motor neuron is responsible for muscle contraction. Ayan. So, yun yung magiging third order neuron. I have already summarized here naman na yung mga order neurons for the descending tract. So, here's another slide just to show you guys kung paano yung pathway ng corticospinal tract. Okay, so magsa-start yan sa cortex, specifically your Brodmann area 4 or the primary cortex, primary motor cortex rather. And then dadaan yan ng brainstem. Okay, brainstem, ano ulit yung tatlong division ng brainstem? You have the superiorly, you have the midbrain, and then the pons, and then the medulla. So pagdaan niya ng brainstem, dadaan siya ng pons. Dadaan siya sa lahat. So midbrain and then pons. From pons, magiging bondo siya. No? But ang kailangan yung tandaan kay corticospinal tract is at the level of the medulla. Anong nangyayari? Okay, parang ang daming special mention ni medulla, no? So at the level of medulla, para din yung mga ascending tract, kailangan din nilang mag-crossover to the opposite side. No? And nangyayari yung crossover na yan or decussation at the level of your medulla. Okay? So, tingnan natin yung picture. From the cortex, dadaang brainstem. Bago yan mag-exit ng brainstem, dadaan kay medulla. Pero kay medulla may gagawin siya. No? Ang gagawin niya is magde-decussate. So, magko-cross over to the opposite side. Specifically, anong structure or landmark sa medulla yung crossover nila or decussation? Ayun yung tinatawag nating pyramids, no? Pyramids of the medulla. Okay, kaya din, ang other name ni corticospinal tract is pyramidal tract. Other name niya yan, ha? So, huwag kayong magpapanik pag nakita nyo. What is the pathway of the pyramidal tract? Si corticospinal tract yung minamention doon. Or ang tinatanong doon. Okay? So, pagka-decussate niya sa may medulla, crossover na. So, for example, ito. This is the right side of the brain. Dadaang brainstem. Pagdating kay medulla, kailangan ko nang tumawid ng bridge via the pyramidal tracts, no? So, tatawid siya, nasa left side na siya ngayon. From the medulla, bababa na siya, no? Okay. So, pagdating niya sa spinal cord, kasi lumabas na siya, nag-exit na siya ng medulla, saka siya magsa-synapse kay second order neuron, which is the anterior horn cells. Okay? Ayan. So, nag-decussate na siya, nag-crossover na siya before mag-synapse sa second order neuron. Kasi, di ba, doon sa ascending tracts natin, magsa-synapse muna bago siya mag-decussate. No? So, different kay descending tract. Okay, and then mag-exit na siya via the spinal nerves and then will become a peripheral nerve depending on the muscle na susuplayan nyo or paggagalawin ng brain natin. Okay, one more time. Ayan. So, at magsa-start tayo sa cortex, no? Right side of the cortex, magde-descend papuntang brainstem. Pagdating kay medulla bago mag-exit ng spinal cord, tatawid, no? Magde-decussate via the pyramids of the medulla to the opposite side. So, nasa left side na siya ng medulla. From the medulla, bababa na ng spinal cord. At the level of the segment, kung saan kailangan gumalaw, magsa-synapse na kay anterior horn cells. And then, e-exit sa spinal nerve roots. And then, magiging peripheral nerve na. For example, kailangan mag-close ng hand ko. So, yung peripheral nerve responsible for flexion of the digits, madami, no? So, example would be the median nerve and the ulnar nerve. So, ito na yung pangalan niya ngayon. From spinal nerve roots ng cervical segments ng spinal cord, magiging peripheral nerve na siya, specifically named as median nerve and ulnar nerve, which is responsible for the contraction of the muscle for closing the hand. Kunyari, gusto kong hawakan yung baso. Okay? Ayan. Please, wag lang kakalimutan what level nagde-decussate si corticospinal tract, and that's again at the medulla. So here's another table. This is again from Waxman. Alright, so this one is reflex. We're going to discuss naman the reflex mechanism, but just a simple type of reflex. So, reflex, kasi we're done now with the anatomy and the descending-ascending tracts. Ito na yung final na topic natin. Reflex, this is a subconscious stimulus response mechanism. Without this, no, hindi natin kayang protektahan kapag hindi tayo aware or conscious yung katawan natin. So, this is extremely important in the diagnosis and localization of neurologic lesions also, not just to protect our body but also for diagnostic purposes. No, kasi if nag-check tayo ng reflex tapos hindi natin nakita yung reflex mechanism, of course, it will signal us na may problem, no? There's a problem with the pathway or the muscle and so on and so forth, okay? So, interruption of simple reflex arc at any point abolishes the response. At any point, pwede, no? Pwedeng hindi talaga yung nerve, yung problema, yung muscle pala may weakness. Pwede rin namang okay ang nerve, okay ang muscle. Ang may pinaka-problema is the spinal cord, yung mga cell bodies. So, it depends, no? Madaming pwedeng affected and that could lead to disruption of the reflex arc. So, the simple reflex arc includes receptor, afferent neurons, interneurons, yung nagko-connect sa dalawang neuron, efferent neuron, and the effector. Napansin nyo, wala na tayong brain dito. Hindi mo ng brain. Wala nang help ng cortex, no? Hindi natin kailangan. Okay? Hindi natin kailangan ang go signal ng brain para mag-respond, para magkaroon ng reflex. Kaya siya mabilis. Kaya siya reflex, no? So, receptor, kung ano man yung type of reflex, kunyari, this is from muscle, no? Yung mga muscle, bigla na lang na stretch. Muscle spindle yung ating receptor for that. Okay? Afferent neuron, sino yung nakaramdam? Sino yung magre-receive na yon? No, na neuron. Interneuron, so ito yung interneuron natin, magko-connect dun sa afferent neuron, which is the DRG, and the efferent neuron, which is the alpha motor neuron or the anterior horn cells, no? And then, effector. Effector is the muscle. Sino yung kailangan din mag-produce ng reflex? So, kung nag-stretch yan, ang reflex na mangyayari is magko-contract. Okay? So, that's your simple reflex arc. So, it depends on two neuron arc, dalawa lang, afferent and the efferent neuron. And we have the interneuron binding them together. Muscle spindle, afferent impulse is inhibitory. Okay? Inhibitory meaning, yun nga, pag nag-stretch kasi siya, ayaw niya yun kasi nga gusto niya maiksi lang ang muscle. So, i-inhibit niya yan. It inhibits motor neuron supplying the antagonist antagonist muscle, and this effect is called reciprocal inhibition. Okay, so for example nga, na-stretch, no, yung muscle. Ang gagawin niya is, kailangan mo mag-contract kasi ini-inhibit niya yung stretching na yon. Okay, that's your muscle spindle. So, we have different types of reflexes. We have four groups: superficial, deep tendon, visceral, and pathologic. So, I think ang magiging focus natin is the superficial and the deep tendon kasi ito yung mga important for assessment, neurologic assessment. Superficial reflexes, ang example would be in the skin and the mucous membrane. Isang assessment na ginagawa natin to assess superficial reflex is sa chan, no? Yung ating abdominal reflex. So, magsaswab tayo ng cotton, magla-light touch, quick light touch, and then makikita natin dapat susunod, no, yung umbilicus. Yeah, yung umbilicus natin, belly button, doon kung saan direction natin nag-swab nung cotton. That's an example. Kung wala yun, ibig sabihin, may problema tayo sa reflex arc. Okay, deep tendon reflexes or your myotatic, these are the pinakasikat, no, na type of reflex. Yung assessment natin dyan is the deep tendon reflex, wherein we use a neurohammer, tapos itatap natin yon doon sa tendon nung muscle na ina-assess natin. So for example, patellar reflex, no. So itatap natin yung patellar tendon, and then dapat magkakaroon ng kicking or extension ng leg, no, kasi yung tapping na yon nag-produce ng stretch doon sa tendon. Again, inhibitory yung ating GTOs dito sa tendon. Muscle spindle kasi is specifically for muscle. So, si GTO din, inhibitory din to. Ayaw niya din na nagsistretch yung muscle for protection din, no? So, once na tinap natin, nagkaroon ng stretch yung tendon, i-inhibit niya yon by contracting. Visceral is mga organs na to. Pathologic, these are abnormal reflexes kasi dapat wala na to, nag-integrate na to. As we grow old, nagde-develop yung mga certain primitive reflexes natin. So pagtanda, dapat wala na. However, there are conditions that it becomes persistent or nagkakaroon ulit, bumabalik sa primitive reflexes, which is abnormal. So kailangan familiar din kayo doon. Now, this can also be classified according to the level of their central representation. We have spinal, bulbar, and the midbrain. This is more specific to the area ng body structure kung anong gusto nyong i-assess, no? Pwede kayong mamili ng reflex kung gusto nyong i-assess spinal lang, okay, or bulbar, or midbrain lang. Okay, and this is mostly following the primitive reflexes, no? Ayan. So again, this is your stretch reflex, also known as the tendon reflex or the DTRs, pinakasikat. Ito yung gumagamit ng neurohammer. So important since it provides a feedback mechanism for maintaining appropriate muscle tone. Deep tendon reflexes are concerned with resting inappropriate stretch on muscles and thus contribute to the maintenance of body posture. So ayaw nga ng mga tendons natin na nasa stretch sila kasi it could be damaging din naman talaga. Aside from maintaining body posture. So, ang gumagana dito, you have muscle spindles, specifically for the muscle. Pag nahila din, na-stretch din yung muscle, not just the tendon, muscle spindles yan. It's an afferent nerve fiber, and there are two types of lower motor neuron responsible for the stretch reflex. You have the alpha and the gamma motor neuron. So, sabi natin dalawang neurons lang ang kailangan for reflex. Isang afferent, in this case, it's the muscle spindle, at isang efferent neuron, which is either alpha or gamma motor neuron, or both na lang, alpha and gamma motor neuron. Okay? And then we have specialized inhibitory interneuron. Okay, interneuron yung nagko-connect dun sa afferent and efferent. In this case is the Renshaw cells. Yung interneuron natin, yun yung nakikita sa spinal cord, no? Kaya nga siya yung thankfully yung structure na reason bakit hindi na kailangan umakyat pa sa brain yung signal para alam natin kung anong response ang gagamitin. That's because of your interneuron, which is again located in the spinal cord. Now let's start with muscle spindles. Muscle spindles, these are specialized mechanoreceptors that are located inside the muscle. It provides information about the length and the rate of changes in length of the muscle, ha? Paulit-ulit tayo sa muscle kasi meron din tayo sa tendon. That's your GTO. Iba yon. Ibang mechanoreceptor na yon. Your muscle spindle contains a specialized intrafusal muscle fiber. Okay, intrafusal meaning nasa pinakaloob pa. So nasa muscle na siya, muscle belly. Meron pa tayong mga specialized muscle fiber within the muscle itself. No? Intrafusal muscle fiber should not be confused with extrafusal. Kaya nga magkaiba sila ng pangalan because extrafusal or the primary muscle cells are found on the outside of the muscle. Wala sila sa loob, nasa labas. Kaya sila extrafusal, no? And it the regular contractile units kasi that provides force underlying muscle contraction can be also received by both extrafusal and intrafusal muscle fiber. Magkaiba lang sila ng location. So, two types of your intrafusal. Yun muna pag-usapan natin, yung nasa loob mismo ng muscle fiber. We have the nuclear bag and the nuclear chain. Nuclear bag is mukha tong bag, no? Kaya yun yung pangalan niya. So, this one is the nuclear bags. Oh, 'di ba? Parang may laman. And then we have the nuclear chain. Mukha silang chain. Okay, yung mga chain na nakaganyan yan. Chain. So the nuclear chain is different from its characteristics sa nuclear bag. Nuclear chain kasi runs longitudinally within the muscle and are arranged in parallel with the extrafusal muscle fiber. Okay? And then we have two types of afferent axon. We're done now with the efferent neuron. Sorry. We're still talking about afferent neurons. Sorry. Okay, so two types of afferent axons is the type 1A and the type 2. So, si type 2 is from the primary endings and then, and secondary endings of the intrafusal fibers of the muscle spindle. So, ito yung mga axon pa ni intrafusal muscle fibers. Okay? Afferent axons carry impulses from the muscle spindle to the spinal cord via the dorsal root, which is basically the dadaan din kasi siya, magsasynapse din sila dun kasi it's still a sensory function. Again, your muscle spindle is inside the muscle, no? And inside the muscle spindle are two afferent axons, and those are your type 1A and type 2. Okay? These are the ones responsible for receiving input kung may stretch. Pag naramdaman itong afferent axons na to na may stretch, isisend niya kay muscle spindle yan. Okay? Na sabihin mo kay interneuron na nasa stretch. So, dadaan niyang muscle spindle, DRG, and then papunta na kay Renshaw cells, which is the interneuron. Pagdating kay Renshaw cell, sasabihin niya, okay, we need to inhibit this stretching. Kailangan niyang isend yung utos na yon kay efferent neuron, which is the alpha and gamma motor neuron. Okay, so the afferent axons muna. Afferent axons provide information about both muscle length and rate of change in the muscle length. Okay? So, si intrafusal or the muscle spindle, specific to sa muscle. Okay? Muscle lang ang inaalam na to. Okay? Iba kasi kay tendon. So, kaya medyo same talaga na alpha and gamma motor neuron gagana dito. Kasi hindi lang, parang mahirap i-isolate na yung nasa stretch lang is the muscle. Kasi pag na-stretch mo yung tendon, automatic sasama si muscle. Hindi mo pwedeng na-stretch mo si muscle, si tendon hindi gagalaw, diba? But, again, muscle spindle is specific to the change in the muscle. Okay, so lengthening, pag nalalengthen na siya, nasa stretch, no, the type 1A fibers produce excitatory response proportionate to the degree of stretch. So, kung gaano lang kalakas or haba yung stretch, ganun din kalakas yung contraction na isisend yung input no, na kailangan for the reflex. So, conversely, contraction of muscle causes inhibition of firing of type 1A. So, kapag may contraction na, nagawa na yung reflex, sabihin, okay na siya. Hindi niya na kailangan mag-fire. Nagpa-fire lang siya kapag may stretch yung muscle. Okay, muscle. That's your type 1A. Now, kapag nagkaroon ng contraction, no, na produce na yung reflex, this then activates alpha motor neuron to the muscle. Extrafusal muscle fiber then contracts, shortening of the muscle, adding to the contraction pa. Okay. Now, let's move on to the efferent neuron. Okay, so nasa efferent neuron na tayo. The alpha motor neuron. This innervates the extrafusal muscle fiber that is responsible for muscle contraction. So, si intrafusal muscle fiber is responsible for identifying if there's stretch. Si extrafusal is responsible for shortening or muscle contraction. Now, this produce an excitatory effect on motor end plate and that will produce contraction. Transmits action potentials rapidly, thankfully, para mabilis din yung reflex natin with a conduction velocity of 70 to 120 miles per second. Okay. So, it innervates the intrafusal muscle fiber. Nasa gamma motor neuron na tayo. So, aside from alpha motor neuron, we also have a gamma motor neuron. So, si alpha motor neuron, done na tayo. This will produce an excitatory contraction of the muscle. Gamma motor neuron excites the intrafusal. No, si alpha is for the extrafusal, which looking at the picture makes sense kasi tinan nyo, si alpha nasa labas yung synapse niya. So ang ma-excite niya is the extrafusal. Okay? Pag na-excite, contraction. Okay, this will produce contraction. Si gamma motor neuron nasa loob na yung synapse niya. This is for intrafusal. Sensory neuron, diba ito din yung nasa muscle spindles na intrafusal fibers natin. Receiving yung stretch naman. Alright. So, the gamma motor neuron innervates the intrafusal muscle fiber. It excites the intrafusal muscle fibers but does not directly cause the contraction. Again ha, does not directly cause the contraction. Instead, it sets the gain on the muscle spindle, modulating the thresholds for stretch reflex and regulates postural tone. So, sino talaga yung nakakapag-produce ng contraction? It's the alpha motor neuron. Sino yung nag-modulate? No? That is the gamma motor neuron. Okay? Siya yung, tama na, para ma-set nila yung point kung gaano lang kadlakas na contraction yung ipoproduce. That's your gamma motor neuron. Okay, Renshaw cell. So, this is the interneuron, no? So, interneuron, this is inhibitory. So, kapag may stretch, ma-activate siya kasi ayaw niya yon, i-inhibit niya. It projects towards alpha motor neuron, specifically producing contraction. So, receive excitatory synaptic input via collaterals, branch from anterior motor neurons, and this is part of local feedback circuits that prevents overactivity in anterior motor neuron. Okay, we're done with the muscle spindle. Now, let's move on with the GTOs, the Golgi tendon organ. So, this one is similar to the muscle spindles, but eto naman ay nasa tendon. Kita nyo? Kasi ito yung muscle, nasa tendon na tayo. So, it is also sensitive to stretch, found within the muscle tendons, and is activated by stretch or contraction. There is a group 1B afferent fibers that arises from the GTOs and end on interneurons inhibiting the anterior motor neurons. It inhibits overactivity of anterior motor neurons similar to the Renshaw cell. Meron din siyang interneuron for that. Okay? Again, nasa tendon na tayo. Okay, so I guess that's it muna for the reflexes, no? Muscle spindle is specific to the stretch of muscles. Golgi tendon organs is specific to the stretch of the tendon. Stretch or contraction, both naman, of the tendons. Sa muscle spindle, meron tayong afferent neuron, specifically the intrafusal fiber. Siya yung magsesend sa interneuron, which is the Renshaw cell, na nasa-stretch yung muscle. So, si Renshaw cell, it's inhibitory. Ayaw niya yon. Magsesend siya ngayon ng utos kay efferent neuron. Specifically, two neurons yan, no? We have the alpha motor neuron muna that innervates the extrafusal fiber na mag-contract. Pero meron ding gamma motor neuron that will modulate the strength or intensity of contraction that innervates naman the intrafusal fibers. And that's how nagkakaroon ng reflex. Okay, GTO, ganun din yan. Meron din siyang interneuron. Instead of muscle spindles, si GTO yung afferent natin. All right. So please be familiar with the segmental innervation of the skin. Your dermatomes, no? These are area of the skin supplied by a single spinal nerve and it's called your dermatome. Be familiar with them kasi kailangan hanggang fourth year na kayo, memorize nyo na, no? Yung mga landmarks na yan. How about segmental innervation of muscles? Pag muscles naman, this is called your myotomes. Now, skeletal muscles also receives a segmental innervation. Most of muscles are innervated by more than one spinal nerve, but be familiar kung what type, no? What type of action yung pinoproduce ng spinal nerve na to. So, for example, C5. C5, anong action ng muscle ang ginagawa? It's shoulder abduction. Ayan. C6 is elbow flexion and wrist extension. So, dalawang muscle yung kanyang nasusuplayan. Dalawang action din yung mapoproduce niya. So, this is your dermatomes and myotomes. Waxman, from Waxman. So, C2 is at the head, no? Behind the head. C4, shoulder. C5, sa may arm yan. Okay, so may biceps area. C6, lateral epicondyle. C7 is the middle finger. C8, little finger. T1, medial forearm. Okay, and then T4 to T10, following lang yan the thoracic segments. Okay, and then on the lower extremity, we have L1. Ay, hindi nakita dito. L3 is medial femoral condyle. L2 is inguinal. L4 is the dorsum of the feet. L5 is the lateral malleolus. S1, S2, lahat na nasa likod. Okay. And then myotomes, ayan. C3, C4 is diaphragm, so respiration. C5, deltoid, shoulder abduction. C5 also is for elbow flexion because it innervates the biceps. C6, brachioradius, forearm flexion. C7, elbow extension. L3, L4, quadriceps femoris, so extension of the knee. Tibialis anterior is L4, dorsiflexion of the ankle. L5, extensor hallucis longus, which is toe extension. And lastly, S1 for gastrocs, which is plantar flexion. So here are another picture pa of your dermatomes, no? Mas ma-appreciate nyo yung different sites nung landmarks natin for the dermatomes. Ayan, no? C4 is acromion process. Wait. So, C4, acromion process. C5, sa may arm, lateral arm. C6, sa may thumb. Pwede nyo gamitin. Or lateral forearm. C7, middle finger rather. C8, little finger. T1, medial forearm. T2, middle arm. T3, axilla. Okay. And then sa lower extremity, L1, groin. L2, inguinal. L3, medial femoral condyle. L4, dorsum of the leg. L5, dorsum of the foot. S1 is the lateral foot. Here's another picture pa. Ang dami, no? Kasi kailangan nyo siyang ma-memorize. This one is from another reference. This is from Magi. I guess ito yung mas ifa-follow nyo for the assessment. Kasi si Magi yung ating reference for assessment, PT assessment. Ayan, C5. Mas malaki yung C5 na ina-encompass dito kay Magi, no? But C5, yan, is arm. C6, thumb. C7, middle finger. C8, little finger. T1, medial arm. T2, medial arm. T1, medial forearm. T2, medial arm. T3, axilla. Iba dito kay Magi, no? T2 niya na-encompass niya rin si axilla. Ayan. So this one is for the lower extremity. L1, inguinal. L2, medial thigh. L3, medial condyle of the femur. Ayan. L4, dorsum of the leg or the big toe of the foot. L5, lateral toes or dorsum of the foot. And then S1, andito na tayo sa paa. S1 is the sole of the foot, lateral sole of the foot. S1, S2 is the heel. Okay, here are tables, no? Yung table sa left, that's from Snell. Table sa right is from McGee. That shows you the dermatome pain, muscle supplied by each root, and the movement affected if you have injury to the specific spinal nerve roots. And last, last is a table from McGee, no? So these are the dermatome of specific spinal nerve roots and what reflexes are affected if you have injury to this specific segment. All right, that's it for your spinal cord and reflexes. I hope you learned something. And if you have any questions or clarification, don't hesitate to message me on MS Teams. I'm Camille. Or you can read your textbooks. No, you have a lot of textbooks to read on. You have Snell, Waxman, Seeley could also work. Um, Tortora, pwede din, and other books that are about clinical neuroanatomy. You can definitely read on that as long as you have an actual reference for that. And yung year niya, year published niya is max na niya is 5 years ago. Okay. Ayan. All right. So this is the end of our lecture. We'll be discussing peripheral nervous system for part 2. Good luck.